Today we're going to talk about children's right to health. I'm going to start today with a couple of scenarios that will help us think about the question, what is the right to health? The first scenario, a person named Sarah Hirschberger, who was 12 years old, born in an Amish family, was diagnosed with lymphoblastic lymphoma, a type of blood cancer. At the time, the success rate for the standard of care treatment was about 85% or better. However, after the first 2 rounds of treatment, the child and the family wanted to stop the treatment. It's very difficult treatment. There's lots of difficult side effects. They wanted to stop, and the family thought maybe it wanted to pursue alternative medicine instead of chemotherapy. So the family stopped bringing Sarah to her chemo appointments, and upon interviews, it was clear the family loved Sarah, wanted the best for her. They weren't in a situation of neglect or anything, but they really didn't like chemo's side effects and thought it was making her more sick. So the question to think about is, should the family have the right to stop a life-saving treatment? Or does Sarah have a right to be healthy, even if it conflicts with her family's religious practices and other health choices? We'll come back to that scenario at the end of the video. Here's another scenario to think about. Tennessee had a decades-old law called the Mature Minor Doctrine that allowed children 14 years old or older to get an approved vaccine without parental consent. Michelle Ficus, then a medical director of the Vaccine Preventable Diseases and Immunization in Tennessee at that time, in 2021, noted this law in an email to physicians who were asking about the COVID vaccine and teenagers who wanted it, but whose parents didn't want them to get the vaccine. After outcry from legislators and parents, Ficus is fired in July of 2021. So the question to think about is, what does a right to health to mean for children? Does it mean at some age? Is there an age when a child should be allowed to make some health care decisions for themselves, such as around vaccination? Or are there situations where the state could require everyone to get vaccinations? And if so, what are those circumstances? And at what point does the right to health for a child outweigh parental rights or personal rights? In 2025, we're seeing a large outbreak of measles in the United States, the largest in more than 3 decades. So what does the right to health mean when it comes to things like measles and vaccination? Should it mean that students and children should have the right to be free of measles, even if their parents are opposed to the vaccine? Or does it mean parents have the final say on what access children have to health? Now, while you think about those scenarios, let's talk about what we mean by health. Health is not just not being sick. It's not just the absence of disease. According to the World Health Organization, it's a state of complete physical, mental, and social well-being. And it goes beyond that to say it's about the enjoyment of the highest attainable standard of health, and it's a fundamental human right without distinction of race, religion, political belief, economic, or social condition. So as we think about strategies for supporting health, again, we're going to look at what's called the social ecological model. It talks about thinking about how health is supported at the individual level by choices we might make in our own lives, by our families and relationships we have, by the community in which we live, and by societal practices, policies, and laws. Now, when it comes to health, one of the things we talk about specifically are what's called the social determinants of health. These are defined as the conditions in the places where people live, are born, work, play, worship, and age that affect a wide range of their health risks and outcomes. So one way to think about this is to think about when you were a child, was it safe to play outside, to walk around in your neighborhood? Was it safe to go out and get exercise? Was there a park nearby where you could play and have fun? Was there a store nearby that had affordable fresh fruits and vegetables and good healthy food for you to eat? Was it hard to get clean water? Did your school have a food that children needed to eat for those who were hungry didn't have food at home? Were you able to go to the doctor and get vaccines and get checkups? Was your neighborhood have a lot of access to illegal drugs and alcohol and firearms? So those are all what might be called social determinants of health, and in fact they can be grouped into 5 broad categories: education access and quality, healthcare access and quality, your neighborhood and the built environment, the social and community context in which you live, and your economic stability. So these are all things that are groups of factors that at the community and societal level really have a big impact on your health. So for example, if we look at some data on the social determinants of health, here's an example showing the relationship between education, gender, and life expectancy. So this particular chart shows life expectancy at age 25. So if you want to get the full life expectancy, you need to add 25 to each of these numbers. But it's very clear from this chart, you can see the role that education plays in connection with health outcomes and life expectancy. So for example, for women, 85 years is expected for those with a college graduate degree. versus 76 years for those with less than high school degree. So you can see how that is a direct step up for each level of educational attainment and life expectancy. So this association between this social determinant of health, in this case education, and life expectancy is directly connected with each other. So that's what we call the social determinant of health. Another example, as with education, there's a similar pattern you see with social determinants of health and race. For example, there's data that shows that black and poor infants in the United States have worse outcomes than their wealthier non-black peers. All right, now let's talk about the right to health versus the right to health care. Now, we often associate the right to health with access to hospitals and doctors, and that's important for sure. But think about that question. Is a busy hospital really a good thing? When I lived in Fargo a few years ago, they opened a large new hospital, and within a short few months of it opening, the hospital was very busy, as you can see from this clip from a news article around at that time. And the CEO of the hospital was kind of excited about how busy the new facility was. The CEO even said, "This is one of the better problems you could hope for." But is a busy hospital really a good thing? I mean, not really, because a busy hospital means there's lots of sick people who need to have care. And in fact, our goal for health should be to have empty hospitals and doctors who aren't busy because our population is so healthy that they don't need treatment for being sick. Now, it's great to have access to health care, preventative care, vaccines, checkups, those kind of things are all very important for sure. But the idea that a hospital being busy is a good indicator of health, it's not. It's a bad indicator of health. It's indicating lots of people are sick. So a healthy population has less need for hospitals. So our goal really should be to have achieve that right to health rather than just the right to health care. So let's look at each of these three areas of health: physical, mental, and social health. So we're going to start by looking at physical health. So looking at the health around the world for children, some very sad and difficult numbers here to see. So worldwide, about 13,000 children under age 5 died every day globally, and that's just 2023 numbers, which is almost 5 million people per year. In the U.S., it's about 24,000 of those under 5 who die in every year. Now, although this number looks big, and it is a big number, we've made tremendous progress since 1990. In fact, a 61% reduction in annual deaths from 1990 to 2023, which is amazing and tremendous progress and fantastic to see. But it is also sad to think about being 61% more of these deaths just 33 years ago. And you can see some more of the data source here at the UNICEF data site. If you're interested in seeing the data and playing with it a little bit, here's a link to a Power BI that you can use where you can click around and look at some of the data by death, cause, and by country. I'll link this in one of our class materials. So looking at the data, the newest year available is 2021. The top causes of death for those under age 4 are prematurity, acute respiratory infections, birth asphyxia and birth trauma, communicable diseases, congenital anomalies, diarrhea diseases, sepsis, other infectious conditions of newborns, injuries, malaria, other non-communicable diseases, measles, meningitis, encephalitis, HIV, AIDS, and tetanus. Now, as we think about prevention of these issues of physical health, vaccines make a big difference and, in fact, address many of the top causes. For example, respiratory infections, communicable diseases, diarrhea diseases, infectious conditions of newborns, malaria. They're really expanding some of the malaria drugs and vaccines that are available. Measles, meningitis, HIV, AIDS, and tetanus all have vaccines that either reduce or prevent transmission of those. So that's a key strategy for addressing health. Although vaccines have been tremendously effective, there's still lots to be done. As we know, the vaccine rates in the U.S. are declining in many areas. And there's still lots to be done in terms of the HPV vaccine, which you can see on the right here, which is uptake has only about 39% of eligible children receiving it. A global vaccine effort is around polio eradication, so they're getting close to eradicating polio, with 2 Middle Eastern countries still having wild polio virus, and most countries in Africa still having some kind of variant polio virus. But really, imagine what a gift that would be to humankind if we could eradicate polio. Imagine no one ever again having to be paralyzed or dying from polio. So it's taken a lot of work, and there's been a lot of progress, but there's still a lot of work to be done to achieve the eradication of polio. Another strategy for reducing these deaths is prenatal, maternal, and delivery care, maternal nutrition programs, avoiding tobacco and substance use, and reducing unwanted pregnancies. Those would go after the 2 of the top 3 causes of death for those under 4. Unfortunately, the United States also doesn't do well in this area compared to other industrialized nations, and that rate has been increasing. And there's also a large inequities between white maternal deaths and non-white maternal deaths. Additional interventions, these are at the community level. These are things like clean water, safe streets, preventing HIV through community initiatives, controlling malaria, providing safe foods. So this addresses a huge chunk of these as well. Injuries is a big one in the United States, for example, many from firearms or motor vehicle injuries. So doing things where you build safer streets, better lighting on streets, decrease access to firearms. Those are all important things to reduce injuries, for example. Those are all community strategies you can do to address these particular deaths. Okay, so that's a quick overview of physical health. Let's talk about mental health. Based on survey data, about 17% of children in the U.S. had at least one mental health disorder. And it's survey data, so it's likely an underreport that many individuals who have these conditions may not know about them or have had the opportunity to have it diagnosed. And even if it hasn't been diagnosed, it can still be an important factor in your health, even if it doesn't rise to the level of a disorder. In terms of access to care, half the children with a treatable mental illness did not receive needed treatment from a mental health professional. So there's really a huge gap between the need and the access to mental health professionals across the country. Some of the differences between the states that you see here have to do with policies such as access to Medicaid, mental health coverages, that sort of thing, that are associated with those kind of differences. So a lot to be done in mental health, a big gap between those who have these conditions and need access to care that are not getting it. And of course, there's no doubt we need more mental health care professionals, more counselors, more school counselors, more trained experts who will support children's mental health. But as with physical health, ideally it would be best to prevent mental health conditions or improve the conditions in which people live so conditions are more manageable. So one analogy I use to think about this example is the mechanic to automobile ratio. If we produce more trained mechanics, it'd be easier to get your car in the shop for a repair, right? So if you need a repair, you need new tires, you need an adjustment to your struts, whatever it might be, having more mechanics out there would make it easier to get that done. But really our goal should be to have well-running vehicles that don't require repair at all. So maybe instead of focusing attention on getting more mechanics and more access to mechanic care for our cars, maybe we should fix our potholed, rutted roads. And that way we can prevent our cars from needing repairs in the first place. So mental health is the same, and so is physical health. It's great to have care, great to have access to support, great to have access to go to dentists, to go to mental health professionals, to go to the doctor. But the more we can do to be healthy and to support health throughout our lives for those who live in our communities, the less need we'll have for these individuals, and we'll be healthy people, which should be the goal in the first place. The last category is social well-being, and there's lots of different ways this has been described or defined. But really, this is an appraisal of this, according to Keyes. This is an appraisal of one's circumstances and functioning in society, and it's made up of 5 different factors. The first is social integration, which is relationships to society and community. The second is social acceptance, which is the ability to trust others, believe others are capable of kindness. The third is social contributions, to be having a role as a vital member of society with something to offer to the world. The fourth is social actualization, which is being hopeful about the condition and the future of the society and recognizing society's potential. And the fifth is social coherence, feeling you can understand what's happening around you. Social well-being, I often think about my uncle, Neil Penn. He was at age 8, had polio, and was not able to use his legs. He's my dad's oldest brother. His career was at Oxford College outside of Atlanta. He was a history professor for 40 years. So he was very well connected with his community. He had lots of students that he connected with, that he cared for, that really loved him, had him as their favorite professor, had great connections with the community, was involved in civic activities and all kinds of events throughout the community. But imagine instead if, due to his polio, he'd been institutionalized because care wasn't possible at home. If his family hadn't been able to provide care, if the community didn't have the ability to provide care, if he had to be sent somewhere for that instead, what would happen to his chances to be socially experiencing well-being? Imagine if his school was not accessible, if he couldn't go to school and learn and achieve a college degree. What would he have done with his life? Would he have had that social well-being? Imagine if his teachers had perceived him as not smart enough to complete a PhD because he was handicapped, had to use a wheelchair, and held him back in school, or didn't call on him or give him assignments in school. Even if he had plenty of money or food or a nice home, what kind of contribution would he be able to make to society, to his community? What kind of pride and fulfillment would he have in his life if these things had been blocked for him? So I imagine this idea of social well-being. He was right on the edge of not having these things, but he was fortunate in this case where he did have care at home that was available. He did have a school that was accessible. He did have teachers who cared about him and pushed him to be everything he could be, and didn't hold him back because of what they viewed as his disability. So let's return to the right of health. What does the right to health mean? At the beginning of this video, I described two scenarios around children's health. One was about whether treatments for sick children could be compelled by the state, and the other on when children should start making decisions about their own health. So to return to this first case, the Amish child, Sarah Hirschberger, she completed the first 2 rounds of chemotherapy, but the family declined to continue. The hospital sued, took them to court, and they won an order to continue the treatment. But when the hospital went to carry out that order, the family had fled to another state to pursue alternative medicine. When the family returned to the state, her cancer was in sufficient remission, and the order to continue the chemotherapy was removed. But unfortunately, without fully completing the chemotherapy treatment, her cancer will likely return and much worse at a later time in her life. In the vaccine scenario, we were seeing big outbreaks in vaccine-preventable diseases, such as measles, and those outbreaks are affecting not just those who choose not to be vaccinated, but also those who cannot get vaccinated, like newborns and immunocompromised individuals. So children have a right to health, but getting there is complex, challenging, difficult, and messy. But that doesn't mean it's time to give up. This week we have 2 readings. One is on how we're failing U.S. children and excerpts from The Right to Health. Look forward to seeing you in class.